Dear Mr. Chairman, dear colleagues, dear organizers of the Rare 2030 conference, dear rare disease patients, ladies and gentlemen, it's a truly great honor for me to address you on this very important occasion, and it is also my sincere pleasure to congratulate you on successfully concluding this important project, which addresses the future of rare diseases within the nascent decade. It has already been a year since European healthcare systems have been under tremendous strain. The ongoing pandemic challenges us to act quickly and protect our citizens at risk. We have been adopting truly unprecedented measures to tackle the pandemic. Solidarity and humanism has become more important than some segments of our economies. All of this is unprecedented. I am well aware of the fact that COVID-19 presents a great risk for rare disease patients. This risk could be either direct, for obvious reasons related to the underlying pathologies, and even more importantly indirect, due to inaccessibility of regular care, due to overhead hospitals, or even in some instances due to the necessity to redirect our resources during the pandemics. Nevertheless, we have not neglected rare disease diagnosis and care, even under such difficult conditions. The Czech government has played an active role in preparing the first ever EU Council recommendations in the field of rare diseases during its presidency in 2009. Since then, we have been collaborating not only with a number of Czech experts, but also with overarching patients' associations at the national level, represented by the Rare Disease Czech, or at the European level by Eurordis, all in close collaboration with our distinguished European colleagues. Since 2010, national plans or strategies for rare disease have been gradually established throughout Europe. National alliances were established or formalized, and despite several shortcomings identified by the European Court of Auditors, we have made substantial progress in terms of care for rare disease in Europe and beyond. In 2017, another major milestone has been reached. We have now functional European reference networks, which are gradually becoming the core infrastructure in the field. Prior to becoming a minister, I have been involved in one of them, and I clearly see their value. Currently, their extension is ongoing, and we hope that the European Commission will find sufficient funding for their coordination. At the national level, we are in the process of preparing a second decade-long national strategy which will capitalize on the outcomes of the Rare 2030 project. We will continue working with the Interdisciplinary Advisory Task Force at our ministry and the National Coordination Center for Rare Diseases at University Hospital Motol in order to make general practitioners and pediatricians aware of rare diseases in order to improve the early diagnosis. My predecessor, who also had supported rare diseases, established a dedicated department at our ministry, the Patient Council, which advises us and reflects patients' interests and needs. This body is actively taking part in preparing new legislative proposals. It provides us with valuable information from the front lines, which we appreciate and do respect. In addition, we broadened the scope of rare conditions, which are subjected to nationwide newborn screening, and will run additional pilot projects in this regard to include additional disorders where there are pre-symptomatic therapeutic interventions. At the EU level, our government is looking forward to the outcomes of the RARE 2030 project. We look forward to use identified core RARE 2030 topics for the upcoming EU Council trio presidency, which is French, Czech and Swedish presidencies, to be held next year. Therefore, let me conclude with the underlying motto of solidarity. We learned that national governments cannot cope alone. We need EU-wide efforts, as it is now the case with the pandemic. Also, we should balance national and EU-wide approaches, and most importantly, we need to place rare disease strategies within the framework of a more comprehensive approach to vulnerable and marginalized populations. Importantly, such approach is at the core of traditional European values. I wish you all the best to the future, and we very much look forward to our future cooperation.